Over 50? Got sudden gut pain, especially in your lower left side? You might have diverticulitis, and ignoring it can be dangerous. This video breaks it all down for you. What diverticulitis actually is, what causes it, how to spot the symptoms early, how it's diagnosed and treated, and what complications to watch out for. By the end, you'll know how to protect your gut and when to see a doctor. Let's get started. Let's start with the basics. Diverticulitis is a condition where small pouches in your colon, called diverticula, become inflamed or infected. But here's where people get confused. Having those pouches is called diverticulosis. It's pretty common, especially as you age, and most people don't even know they have it. But when one of those pouches gets blocked, usually by a small piece of stool, it can become irritated, swollen, and painful. That's diverticulitis. Think of it like a clogged drain in your gut. Pressure builds up, and suddenly, there's a problem. So remember, diverticulosis, just the pouches. Diverticulitis equals when those pouches get angry, and that inflammation is what causes all the trouble you'll learn about next. Now let's take a closer look inside the colon. These little balloon-like pouches you see? Those are diverticula. They usually form in weak spots of the colon wall, especially in the sigmoid colon, down in the lower left side of your belly. Sometimes a small piece of stool, called a fecalith, can get stuck in one of those pouches. When that happens, bacteria can grow. The result? Inflammation. The pouch becomes red, swollen, and painful. That's diverticulitis. The colon wall around the pouch also reacts. Your immune system jumps in, sending white blood cells to fight the infection. But that immune response adds more swelling, and now you've got pressure, pain, and possibly even infection. That's why diverticulitis can be so uncomfortable, and why it almost always shows up as sharp, steady pain in the lower left belly. In some people, it even leads to fever, nausea, and changes in bowel habits. And when it's really bad, it can cause some serious complications. More on that coming up. Diverticular disease isn't just one thing, it's a spectrum. Let's break it down. First, there's uncomplicated diverticular disease. That means you have diverticula, but no infection or inflammation. You might not even know it's there. Or you might feel mild bloating, cramps, or changes in your bowel habits, especially after eating. It's common, especially over age 50, and most people never have serious problems from it. Next, there's diverticular bleeding. This happens when a small blood vessel inside a pouch gets damaged and starts to bleed into your colon. The bleeding is usually painless, but it can be heavy. It shows up as bright red blood in your stool or on the toilet paper. It's scary, but it often stops on its own. But the most serious form, and what this video is really about, is diverticulitis. This is when one of those pouches becomes infected or inflamed. It causes sharp, persistent pain, often in the lower left abdomen. You might also get fever, chills, nausea, or even constipation. It can be mild and treatable at home with rest and antibiotics. But in severe cases, it can lead to abscesses, perforation, or even emergency surgery. Coming up next, how to recognize the warning signs before it gets serious. So what actually causes diverticulitis? It starts with tiny pouches called diverticula, and they form when pressure builds up inside your colon. One big culprit? A low-fiber diet. Without enough fiber, your stool becomes harder and smaller. Your colon has to squeeze harder to push it out, and over time, that pressure creates weak spots. But fiber's just part of the story. Other major risk factors include aging. Most cases happen after age 50. Obesity, especially belly fat. Smoking doubles your risk. Lack of exercise. Movement keeps your bowels moving. Regular NSAID use, like ibuprofen or naproxen. And what about nuts, seeds, and popcorn? For years, people were told to avoid them, thinking they could get stuck in those pouches. That's a myth. Research shows no link between eating those foods and getting diverticulitis. In fact, many of them are high in fiber, which actually helps protect your gut. So don't ditch the almonds or the popcorn. The real enemies? Ultra-processed foods, low fiber, and chronic inflammation. Next, how do you know if you actually have it? Let's talk symptoms and diagnosis. So how do you know if you have diverticulitis? The most common sign is left lower quadrant pain. That's the lower left side of your abdomen. This pain is often constant and may start mild, but it can get severe. If it's been lingering for more than a day or two, you should definitely take note. Other common signs include fever, your body's way of fighting infection, nausea and vomiting. This can happen if the infection causes an obstruction in the colon. Changes in bowel habits. Some people experience constipation while others have diarrhea. Urinary symptoms. You may feel frequent urgency or burning when urinating. This happens because the inflamed colon can press on your bladder. But here's something important. Not all cases look the same. In Asian populations, diverticulitis is more likely to cause right-sided pain, typically in the right lower quadrant, or even the suprapubic area. So, while left-sided pain is common in Western countries, if you're experiencing pain on the right side, it's worth considering this possibility, especially if the pain's been persistent. Now that we've covered the symptoms, how do we figure out what's going on? While many cases of diverticulitis are manageable with treatment, things can get serious if it's left untreated. Let's take a look at the possible complications that can arise. First up, peritonitis. This is a dangerous condition where the infection from a perforated diverticulum spreads to the abdominal cavity, causing widespread inflammation. This can make you feel very ill, with severe pain, fever, and potentially life-threatening issues. Peritonitis often requires emergency surgery. Next, we have abscesses. These are pockets of pus that form when the body tries to contain the infection. An abscess may need to be drained, sometimes using a catheter or through surgery, depending on its size and severity. Then there's the risk of a fistula. A fistula is an abnormal connection that forms between the colon and another organ, such as the bladder or skin. This can lead to strange symptoms like feces in the urine or infections in other organs. Surgery is often required to repair the fistula. Lastly, bowel obstruction. If diverticulitis leads to swelling or scar tissue, it can block the passage of stool through the colon. This is another emergency situation, and surgical intervention might be necessary to clear the obstruction. As you can see, these complications can be serious. This is why early treatment matters. If you notice any signs of diverticulitis, don't wait for the symptoms to get worse. Prompt treatment can prevent complications like peritonitis, abscesses, and obstructions. And the sooner you act, the better your chances of avoiding these dangerous outcomes. When it comes to diagnosing diverticulitis, doctors are looking for a few key signs and symptoms. The primary clue is usually left lower quadrant abdominal pain, along with changes in bowel habits and fever. Doctors will also ask about your medical history and risk factors, like age, diet, and physical activity level. But to confirm the diagnosis, a CT scan is the gold standard. Why a CT scan? It's the most accurate way to see the inflammation and identify any complications, such as abscesses or perforations. The CT scan helps doctors determine the severity of your diverticulitis and whether any immediate treatment is needed. One thing to keep in mind, colonoscopy is avoided during an active diverticulitis flare. Why? Because the colon wall is inflamed and weakened, making it more vulnerable to injury. Inserting a colonoscope could cause a perforation, which would worsen the condition. Instead, doctors prefer to wait until the inflammation settles before performing a colonoscopy. When it comes to treatment, it all depends on the severity of the condition. For uncomplicated diverticulitis, most patients can be treated outpatient. This means they can go home, take oral antibiotics, follow a special diet, and monitor their symptoms. Doctors may start with a liquid diet for a few days, gradually reintroducing soft foods before getting back to regular meals. Antibiotics like ciprofloxacin or amoxicillin clavulanate are typically prescribed for 7 to 10 days to clear up the infection. However, if the diverticulitis is more severe, or if complications like perforation or abscesses are suspected, inpatient care is necessary. Patients in the hospital will receive IV antibiotics, fluids, and pain management. They may also be put on nothing by mouth, NPO status, to rest the colon. In cases of complicated diverticulitis, surgery might be required to address issues like bowel obstruction, abscess drainage, or repairing a fistula. Now, it's important to know when diverticulitis may require urgent care. Some red flag symptoms include severe abdominal pain that doesn't go away, high fever over 102.5 degrees Fair or 39 degrees Celsius, rapid heart rate or low blood pressure, signs of sepsis, bloody stools or a sudden change in bowel movements, severe nausea or vomiting, especially if it's associated with an obstruction myelivus. If you experience any of these symptoms, don't wait. Seek medical attention immediately. Timely intervention can prevent serious complications. Let's quickly recap what we've learned about diverticulitis. Diverticulitis occurs when small pouches in the colon, called diverticula, become inflamed or infected. The most common symptoms include left lower abdominal pain, fever, nausea, and changes in bowel movements. Causes include a low-fiber diet, aging, obesity, and other lifestyle factors. Treatment often involves antibiotics, diet changes, and sometimes surgery if complications arise. Early diagnosis and treatment are crucial to prevent serious complications like perforation or abscesses. Remember, if you experience persistent abdominal pain or notice any changes in your digestive health, don't ignore it. Early intervention can make all the difference in managing diverticulitis effectively. I hope this video gave you a better understanding of diverticulitis and how to manage it. If you found this information helpful, please like this video and subscribe to the channel for more insights into gut health and other medical topics. And don't forget to hit the notification bell so you never miss an update.